Hello, my name is Gabriel Sotomayor, and I am doing this presentation with my mentor, Dr. Shashank Davé. Our case report is entitled Rare Side Effect of Hypothermia in the Setting of Cerebral Spinal Fluid Leak After Intrathecal Baclofen Pump Placement. The objective of our case is to present a case in which a patient experienced hypothermia as a side effect of baclofen overdose. With this presentation, we wanted to educate about the possibility of this rare side effect so that providers will consider this as a possible cause of hypothermia and will be able to better treat it. A little bit of background. Baclofen is a gamma-aminobutyric acid B agonist that in rat and chicken studies has been shown to cause a reduction in body temperature. Baclofen withdrawal, on the other hand, has been shown to cause hyperthermia in the human and animal model. While no definitive mechanism has been found to show the effect of baclofen on temperature regulation, its activity within the hypothalamus is likely the source. So how did we conduct this case study? Well, we looked at a single patient case study with a patient who had an intrathecal baclofen pump placed with subsequent cerebrospinal fluid leakage. When she went to have surgery to repair the cerebrospinal fluid leakage, she was found to be profoundly hypothermic, and only when the leak was repaired and the intrathecal baclofen pump was removed did all of her symptoms go away. So, a little bit more information about the case. This case involved a 33-year-old female with a past medical history of traumatic brain injury and cerebrovascular accident seen 2 weeks after acquiring an intrathecal baclofen pump due to medically refractory spasticity. She was admitted to the hospital by neurosurgery to correct a suspected cerebrospinal fluid leak. Prior to the surgery to fix the cerebrospinal fluid leak, she was found to be hypothermic with a temperature of 30.8 degrees Celsius. And after 1 hour of warming, they were only able to get her up to 34 degrees Celsius. The leak was initially repaired with a Tecel plug, and her hypothermia initially improved. In the following days, her spasticity was unchanged, and she was started on oral baclofen, and they up-titrated her intrathecal baclofen dosing. A few days later, she experienced hypothermia again, this time with a temperature of 34.4 degrees Celsius, and she continued to show evidence of a cerebrospinal fluid leak. The patient then underwent an explantation of the baclofen pump, as well as the catheter, on top of repairing her CSF-Leak with an intradural Tecel due to concern for baclofen-induced hypothermia. The patient was then weaned off the baclofen and up-titrated on diazepam without any other instances of hypothermia. So key things to know when looking for baclofen overdose. The following symptoms are ones you should look out for. Those include altered mental status, lethargy, seizure, hypothermia, bradycardia, nausea, vomiting, and autonomic instability. So, in this case, we present the rare side effect of hypothermia as a result of baclofen overdose. The purpose of this study was to educate and inform physicians, nurses, therapists, and all other members of the allied health team to look out for this adverse outcome so they can be better prepared to treat it. By understanding the mechanism, physicians will be able to know when to wean off the baclofen and when to start increasing the amount of benzodiazepines. In conclusion, this case demonstrates the need for conducting further research on the effect that baclofen has on temperature regulation and how that must be taken into consideration when prescribing high concentrations of the drug. Future studies should look into the percentage of patients that experience hypothermia as a side effect of baclofen overdoses. Thank you so much for listening to my presentation, and I hope you have a nice day.